As of January 11th, 2022, we currently have 365 active cases in our area. However, this is an underestimate of total number of cases due to testing eligibility and the newest guidelines. Our percent positivity rate for January 3rd to 9th is 17.71%. We've had 13 deaths since the beginning of the pandemic, with an increase in the number of deaths over the month of December and since the beginning of December. And 7 people are currently hospitalized with the virus. And looking at the data, there has been an increase in hospitalization since the beginning of December. Please note that the cases reported in the Sioux Lookout Health Hub include cases in First Nation communities. A complete list of communities that fall under the Sioux Lookout Health Hub can be found on our data reporting website. This week, we will add on our reporting website to provide more information about hospitals and ICU capacity in the region. We will send an email to media when this information is available on our website. These type of metrics show the impact COVID-19 is having on our local healthcare systems. The Omicron variant has been seen in communities across the region. Not all samples are tested for Omicron anymore, but it is likely to be in most, if not all, communities in our area. Due to the transmissibility of the Omicron variant, I recommend that residents have essential items on hand in case they're required to self-isolate. With a high percent positivity rates, it is likely that many households will need to self-isolate within the coming days and weeks. Items to purchase include pain relief medications like acetaminophen and ibuprofen, frozen or canned fruits and vegetables, other non-perishable food items, personal hygiene products, and cleaning supplies. The new guidelines from the province of Ontario require anyone with symptoms and their household members to isolate for 5 days if fully vaccinated or under 12 years old, or 10 days for anyone not fully vaccinated that is age 12 or older. Anyone who's unsure whether their symptoms require isolation should visit www.ontario.ca/exposed for more information. PCR testing is no longer available for much of the population, and anyone with symptoms should assume they have COVID-19. People with symptoms of COVID-19 and their household members must self-isolate and should assume their illness is COVID-19. Testing is not necessary for those who do not live, work, or visit high-risk settings as defined by the Ministry of Health. For more information on what to do if you are a close contact, have symptoms, or test positive on either a rapid test or PCR test, and what constitutes a high-risk setting, please visit our website. We previously had a letter of instruction in place for our workplaces. I have rescinded the letter as it no longer aligns with the new COVID-19 guidance. Furthermore, workplaces should not require a negative COVID test for their employees to re-enter the workplace. Depending on vaccination status, risk level of the workplace, and symptom improvement, they will have to isolate for 5 to 10 days if they have symptoms or a positive test result. There's different guidance for high-risk workplaces. More information about such workplaces can be found on the Ontario website.